Hey guys, welcome to Man Medicine, where we talk about how men can optimize their health and escape the collapsing U.S. healthcare system. Today I want to talk with you a little bit about what I consider to be the things you want to look for when you choose an age management clinic or a men's health clinic, and talk about some of the red flags that I've seen out there as well that if you see these, I think are a good sign that maybe you should steer clear of those particular clinics. Now, as you guys know, there are men's health quote anti-aging clinics popping up all over the country now in all 50 states. They're incredibly popular. They're very lucrative, and so they make a lot of money, and so they become very attractive to providers out there who are looking to escape from mainstream medicine and open up some of these clinics. And unfortunately, there's no quality control at this point in terms of opening these clinics. And so what you'll find is some that are absolutely excellent and outstanding, and then some of them that are just downright terrible. And it can be hard to tell because a lot of them have slick marketing, slick advertising, and you don't always know what you're getting until you walk through the door. So I want to talk a little bit about that today. And I have mixed feelings about all of these men's health clinics that are popping up everywhere. Treating low testosterone it's really important, and there are not even close to enough endocrinologists out there to ever manage this. This is a global problem, and it's only getting worse. And certainly there are not enough primary care physicians that feel comfortable doing this. And so without these clinics, I think the majority of men that would benefit from testosterone therapy are just not able to get it. So that's, on the bright side, I think that's a good thing. The problem is, like I said earlier, that the quality of these clinics varies widely, and it only takes a small number of these clinics doing things poorly to give the whole industry a bad name, and that's unfortunate because as they say, one bad apple ruins the whole bunch. So again, I have mixed feelings about this. So what do I look for in an age management clinic or anti-aging clinic? First of all, I hate the term anti-aging. All right, all of us are going to age. All of us are going to get older. All of us are going to die one day. So being anti-aging is, it's jousting at windmills, pissing in the wind, so to speak. I prefer the term age management. As we age, we want to manage our aging. We want to do it in such a way that allows us to maximize our health, maximize our quality of life for as long as possible. We're extending our health span as far into life as we can. We may extend our lifespan, but we don't necessarily have the ability to do that, but if we can, we do it. But the most important thing is the health span, meaning I'd like to focus on the last 10 years of your life. I say this a lot, that when you start an age management program, what you're really doing is you're training for the last 10 years of your life. Because if you think about it, for the vast majority of people, especially in the United States, the last 10 years of your life tend to be pretty miserable for a lot of people. It's one medical catastrophe after another, and it's this precipitous decline. There's a massive increase in prescription medication use. Some people are admitted to the hospital 2-3 times a year with different issues: heart failure, exacerbations, pneumonia, broken hips, etc. And obviously in an age management program, you want to take a number of different steps to avoid that if you can. So, and a lot of that stuff is largely avoidable, but you have to have a good clinic, you have to have a good provider, and more than anything, you have to do your part, as well. So, what does a good clinic, a good age management clinic do? A good age management clinic should address what's called the hallmarks of aging. Okay, so what are the hallmarks of aging? They're laid out here in this paper. It's called New Hallmarks of Aging. This is from 2022. This has been updated since 2013. It's from the journal Aging here in 2022. If you want to look up this paper, you can go to aging-us.com. It's a really good paper. And I'm not going to go through it in all the details, but this is a kind of a pie chart here that shows you what they consider to be, and I agree, the hallmarks of aging. These are the things that happen to you as you get older. And if you are in a good age management clinic or quote anti-aging clinic, they should be addressing all of these issues. right here, okay? This is everything from mitochondrial dysfunction, cellular senescence, compromised autophagy, disturbance of the microbiome, chronic inflammation, telomere attrition, et cetera, et cetera. I'm not going to go through all of these, but they should know, and your doctor should know what these hallmarks are, and they should have an approach. Not all of these are entirely treatable, but there are many things that you can do, mostly lifestyle related, to address all of these issues. So your doctor should know what these are, and the program that doctor puts you on shouldn't be some cookie cutter program. It should be specifically tailored to you with the purpose of addressing all of these hallmarks of aging. What I see instead is essentially these are just hormone pill mill clinics. They're testosterone mills essentially. So I did a Google search of some of the men's health and anti-aging clinics in the area where I work, and you know what? That's what they are. These are testosterone clinics. So they're high volume TRT clinics. I didn't see a single one that mentioned any of the hallmarks of aging or really anything other than bioidentical hormone replacement therapy, which again is great, especially if it's done well. But I don't think you should call yourself an age management or an anti-aging clinic if all you do is hormones. If you're just pushing hormones on people, that's not age management. Okay? Having an optimal testosterone level is great, but it is the tiniest little tip of the iceberg of what you need to do to have a comprehensive age management evaluation and age management protocol. So anyway, the other thing that I look for, so they should know the hallmarks of aging. The cornerstone, in my opinion, of a good age management program is very aggressive cardiovascular risk factor modification. I mean, what are the things that kill men in this country? It's cancer and it's heart disease, not in that order. Heart disease is first. So there's no point in you having a perfectly optimized testosterone and thyroid level and your IGF-1 is perfectly dialed in. If you end up developing triple vessel coronary artery disease in your 50s or 60s and end up dying of a heart attack, or you end up a cardiac cripple because you develop congestive heart failure, which is entirely avoidable. And I don't see in any of the clinics that I looked at, and even the ones that I'm aware of personally, there is very little emphasis, if any, on any of this stuff. You might get a standard lipid panel, and that's it. Which you can go to your family doctor for that. You don't need to go to one of these clinics. So they're just all about hormones. They're not looking at the things that kill men, which is again heart disease and cancer. So these are clinics that they need to do in-depth lipid analysis. Okay, they need to screen for coronary artery disease. And at the minimum that can be a CT coronary calcium score. There's increasing evidence that a CT coronary angiogram in the right men who have higher risk can be very useful to look at the coronary anatomy, and in particular not just calcified plaque, which can is important, but soft plaque, because soft plaque is typically the plaque that tends to be a bit more inflamed, perhaps a little bit more likely to rupture. So those are really useful tests. Carotid intimal media thickness testing with an ultrasound can be very, very valuable, looking for and screening for peripheral vascular disease. None of these clinics do this, or very few do. These are all really, really useful tests. There are so many men walking around, and I know this because I found it. There are so many men walking around in their late 40s and early 50s with triple vessel heart disease that they're completely unaware of. And that's why you hear about these people that are otherwise completely fit, like marathon runners that keel over and die. You think that they're fit, but it turns out that they had terrible coronary artery disease. I'm trying to think of the guy offhand who was the trainer, Bob, I forget his last name, from The Biggest Loser, right? Super fit dude. I think he was 50, maybe 49. I could be off on that. Had a massive heart attack. Actually had a cardiac arrest apparently in the gym while he was working out. Turns out he had markedly elevated lipoprotein A levels, which should have been picked up, years prior to that. It's a well-known risk factor. It's something that I check for in all of my patients. It's highly heritable. never picked up. So he had a terrible coronary artery disease. The poor guy nearly died. He is incredibly lucky to be alive. And, again, I feel like if he had a really good age management physician 5 to 10 years before that, they could have picked up that plaque that he was developing. They could have addressed all of his other cardiac risk factors. Who knows? Maybe they could have done something to prevent that. So the focus in an age management clinic, too, this is really important. Your doctor should be spending most of their time talking about lifestyle changes. So we should be talking about exercise. We should be talking about low glycemic, anti-inflammatory nutrition. If they're spending 90% of their time talking about your hormones, that's a red flag in my opinion. The bread and butter, the low-hanging fruit, the things that make the most difference at this point are not hormones. They're not fancy supplements. It's lifestyle. If you go into one of these clinics and it's hormones, specifically testosterone, and that's all they want to talk about, and they're pushing testosterone on you, and they're either giving lip service to lifestyle or they're not mentioning it at all, that's a huge red flag. I would go somewhere else, unless you're already an expert in that area. If you already really know, if you have the rest of that stuff dialed in and you just need a testosterone prescription, okay, fine, go do that. That's fine. But I think that's really important, and that's where I think these clinics get this stuff wrong, is they are all about pushing hormones and supplements, and they just give lip service to the lifestyle, to the nutrition, which is a shame, because that's what really matters. That's truly what impacts longevity and impacts health span. It's not the testosterone prescription that I write for you. It's not the multivitamins that you might take. It is diet and exercise, and it's super important. And unfortunately, I think it doesn't get the attention that it deserves. So the other thing too that a good clinic should do, they should not be rushing you in and out of there. Your initial consultation with your doctor, in my opinion, minimum should be an hour. Not only to explain all the pros and cons of whatever protocol that they think might be best for you, but to go over your labs, to answer all of your questions, and to just to listen to to take a good history and do a good physical exam. It's basic stuff that they teach you in medical school. Take a good history and do a good physical exam. So that's a minimum of 1 hour. In a new intake, for me, it depends on what the patient brings to the table, how many of what other chronic medical problems they have, but it's usually about 2 hours, 2.5 to 3 hours, where we sit down in a telemedicine format, and I run through all their labs, I go through all their questionnaires, I ask them a inordinate amount of questions, because I want to have a complete picture of what's going on, because I don't do cookie cutter protocols. I need to know in excruciating detail what's going on with this person's, with their lifestyle, with their laboratory studies. We go into nutrition. We talk a lot about exercise. So these are not short visits, and that's the same for follow-ups. You shouldn't be going in and out and like your family practice doctor and having like a 15-minute appointment with a good age management doctor. They should be, unless you are 100% dialed in. These are 30-minute to an hour appointments for follow-ups, in my opinion, because this stuff is complicated, and you need the time to do it. And I certainly can't do it in 15 or 20 minutes, and I would be doing you a disservice as if you were my patient if I just blew through you. But that's the business model, unfortunately, for a lot of these men's health TRT windmill clinics, is they just want to crank out patients. 25, 30 a day plus, in and out. Here's your testosterone prescription. Pay your monthly fee, $300, $200, whatever, how many dollars it is a month, and we'll see you back in a couple months, etc. So they just they're high volume. I don't think you can have a good age management clinic that is based on this like big tent approach where you just want to bring in the masses. Unless you have like a lot of doctors working for you, because it takes a lot of work, it takes a lot of time, and quite honestly, like that's what I enjoy about age management medicine, is sitting down and really like dissecting people's problems and coming up with game plans. I enjoy the follow-ups, and because that's how you get good results with your patients. So if you're just getting whisked in and out of there, that's a huge red flag for me. The other thing that's a bit of a red flag for me is a lot of these clinics are doing like this IV nutrition, IV therapy stuff, which, I'm going to be honest with you, the literature on that the scientific literature for the efficacy of for the average person who has a normal functioning gut is poor. However, there's something about it that I think there's a very strong placebo effect. They're very expensive. The charge is very expensive. It's not expensive for the clinic. These Myers cocktails and, different, IV vitamin infusions and stuff. Most of that stuff, to be honest with you, is bullshit. It's bullshit. But they're more than happy to charge you $200, $300, $400, $500 to rehydrate you with a bag of lactated ringers that they've squirted in some vitamins that cost them pennies. And people like it. They sit there with an IV. There's something about the experience. They get to watch the magic yellow water go in, and they feel better. But guys, what you're getting out of that in most cases is not worth $300 or $400 or whatever it is that these clinics are charging you. So when I see clinics that offer IV therapy, which is almost universal, I'm like, that's a clinic that doesn't necessarily practice evidence-based medicine, but that's a clinic that probably makes a lot of money. I can't bring myself to do it because I just don't believe in that there's enough science to warrant that. Vitamin shots, total hogwash for the most part. These intravenous or intramuscular vitamin shots that clinics provide, the margins on those are huge. They charge so much money for those. Unless you have some sort of, an innate malabsorption issue, a problem with your gut, they're bullshit. I refuse to prescribe them, quite honestly. You're not going to get B12 injections from me unless you have pernicious anemia. Okay, I just don't feel good about doing that, especially when you can take an oral version for pennies and get the same effect. So let's see what else here. Appropriate medical workup. So I talk about this a lot. So this is especially related to testosterone. Many of these clinics, they do a good job. They diagnose hypogonadism, or if they meet that, or they diagnose based off of a low testosterone number and an appropriate symptom score, whether you use the aging male score or whatever. They make the diagnosis, but many times they don't explore why the man has low testosterone. Many times it's idiopathic. Most of the time it's obesity, lifestyle, endocrine disrupting hormones, etc. I've talked about this in other podcasts, but many times it's, well, not many times, but sometimes it's not. Sometimes it's more serious. Sometimes you have a freaking brain tumor, like a prolactinoma. Sometimes you have hemochromatosis. Sometimes you have some other, like, potentially more serious medical condition. Maybe you got a varicocele that you're unaware of, or you don't mention, or they don't do a proper testicular exam on you to find. So those are important because that has serious implications. And if you miss that, shame on you as a doctor. That's your job, is to pick those up. But most of the guys I talk to that come to me that are already on testosterone, did your doctor ever tell you why you have low testosterone? Nope. No idea. They might have done the workup, but they didn't convey it to the patient, which, is kind of the whole point as well. Now, the last red flag is going to probably get me in trouble a little bit. And I'm going to preface it. My point is not to insult mid-level providers, to insult naturopathic physicians. I think that these providers are perfectly capable, if they've taken the appropriate training postgraduate in testosterone replacement therapy. I think that they're perfectly adequate to take care of otherwise healthy men with hypogonadism or suboptimal testosterone. In that population, let's be perfectly honest. It's not rocket surgery. Okay, there's a few pitfalls, but if you have the training, it's not that hard. The problem that I see, and that I have a little bit of heartburn with, is in many states in this country, nurse practitioners and naturopaths are allowed to practice completely independently, meaning they don't have to have an MD or a DO that is there to supervise them or to assist them, in the clinic with difficult cases. So they basically, after they're in the case of a nurse practitioner, they do 2 years of training, some of which is online, or in the case of a naturopath, they go to 4 years of naturopathic college. They can go out and hang up a shingle and they can prescribe all the same drugs that I do as a double board certified MD, with a small fraction of the amount of training and experience that I have as an MD. But the general public really doesn't have a good understanding of the difference between a nurse practitioner, a naturopath, and an MD in terms of the training that they have. I think it's perfectly okay to ask whoever you see, are you a medical doctor? Are you a physician? And if the answer is yes, you should feel perfectly comfortable asking them, hey, where did you get your training on how to do hormone replacement? Because I'll be honest with you, as an MD or DO, unless you're a board certified endocrinologist or urologist, you didn't get much training in this stuff. You had to go get it somewhere else after you graduated your residency. And the same is with nurse practitioners. I mean, they're not going to get any of this stuff. And naturopaths, I think they may get a tiny little bit of this in their 4-year program, but certainly not enough to be entirely competent and independent, in my opinion. So I'm going to show you guys some statistics here. And again, I feel like I just need to say this because I'm probably going to get some hate mail about it. I'm not saying this to bash mid-levels or naturopaths, but mainly for you guys as my audience, just to have a better understanding of the different types of training that these different providers go to. And this is, to a large degree, why the experience you might have may vary from one clinic to another. If you go to a clinic with a naturopath, it may be different than the clinic experience you have with a nurse practitioner versus an MD. Okay, so let's talk about naturopathic physicians real quick, and just talk about how they compare to MDs in just a few areas, and specifically family medicine physicians. I'm board certified in family medicine. That was my first residency. Naturopaths in several states in the United States are allowed to call themselves primary care providers. I've seen the websites of some in the local area here that call themselves family medicine providers and family practice providers, which kind of gets my hackles up a little bit because I personally don't think that that's appropriate. I don't think they have the training for that. This is from the American Academy of Family Physicians. I just kind of clipped this out here. This is a small part of a larger diagram. The rest of it wasn't particularly relevant. So this is comparing board certified family physician. So board certified family physician, 4 years of MD school, 3 years of family medicine residency. Naturopathic physician, 4 years of naturopathic medical school. As it says here, optional residency. Most naturopaths don't do a residency right out of school. They can hang their shingle and do exactly legally what a board certified family physician takes 7 years of training to do. But the kind of training that you get is massively different. So let's just look at total hours. I'm not even going to talk about the quality of the training because it's vastly different. But average family medicine doctor, total training, 20 to 21,000 hours to become a board certified. This is your regular family practice doctor that you go see, when you have a sprained ankle or a cold, has done over 20,000 hours of training just to have the right to go to work, to call themselves a family medicine doc. Naturopath, 5,500 to 6,400. We'll call it 6,500. So that's a difference of approximately 15,000 hours of medical training. Okay. Now let's talk about nurse practitioners real quick. I don't have the time or the similar kind of data for nurse practitioners, but there are many nurse practitioners out there that are now getting DNP degrees, which is a doctorate in nurse practitioning. It's basically like a PhD as a nurse practitioner. And the thing that also gets my hackles up a little bit is that there are some of these providers out there, these nurse practitioners, that like to be called doctor because they have a doctorate degree. But I'm telling you that also the difference in quality is massive. And this is just one little piece of data that shows that. So for about a 4-year period from 2008 to 2012, they gave DNPs what was the equivalent of like this USMLE Step 3 exam, which is something that physicians have to take. MDs, it's USMLE Step 3. Osteopathic docs, I'm sorry, I forget what the name of the test that you take is, but it is equivalent. So you take this. So I took this test during my internship. So I'd finished medical school, and it was towards, I think it was like spring of my intern year. Which, by the way, at that point in my training, so almost 5 years of training, I was still grossly incompetent. I was nowhere near being good enough in any capacity whatsoever to see patients by myself. Not even close. Not even close. So, having said this, I took this test here. There is a step 1 and a step 2 exam that you do during medical school that is extremely difficult. This step 3 exam was easy. This was not a hard exam for me. And you can tell here because look at the pass rates for MDs and DOs. So well in the 90%. Like if you were semi-conscious during your internship and paid attention even halfway, you're going to pass this test, okay? Look at the pass rate. Now this is a watered down, like simpler version of this USMLE step 3 that they gave to Doctor of Nurse Practitioner students. Look at the pass rates. Like 49%, 57%, 33. So they had a good year in 2011. 70% of them passed, but that's abysmal. Okay, and I'm telling you, this is if you've done 4 years of med school and a conventional internship of any kind, whether it's general surgery, this is an easy test. I thought it was easy. Everybody I know said it was. Of the 3 USMLE step tests, by far step 3 is the easiest. And we have, in some cases, 33% of nurse practitioners passing this, versus, mid 90% for MDs and DOs. So, having said that, again, I'm not trying to bash these providers, but guys, there's a difference. There is a difference. I think it's completely fine if you go to a age management clinic, a testosterone clinic, and the person that you interact with primarily and who works with you is a mid-level provider. I think that it's probably best if you go to one where that provider has physician supervision by an MD or DO. They don't have to see you every time. You may only see them once, but they should be reviewing the charts of that mid-level provider and just keeping a lookout, just to make sure everything is okay. There are some really good nurse practitioners out there that I've worked with, some excellent PAs. I was involved in training PAs when I was in the Air Force. I am pro PA. They're a huge help to me in the emergency room at times. But guys, even the best of the best there, they just don't have the same level of training. And again, this is not about being smart. Okay, this is not about being smart. It's just about time and training. 10 years of training versus 2 is massive. It just is. It doesn't matter how smart you are. It's just the amount of training and exposure that you've had in the course of your medical career. So to circle back, again, if you're otherwise healthy, there's no reason you can't see a mid-level provider. But if you, again, and I've said this at other podcasts, if you're bringing some of these conventional sick care problems to the table, heart failure, coronary artery disease, chronic kidney disease, poorly controlled hypertension, history of stroke, whatever, you're gonna want a physician, an MD or a DO, or you're gonna want a mid-level provider who not only is very good and has been around the block for a while, but who also has backup, from a physician. That's, in my opinion, what you should look for. But a lot of these clinics, I know every single one in the local area where I live, there's no physician to be seen. Well, there's actually one where there's a physician. I take that back. But all the rest of them, nope. There's not they're either completely run by nurse practitioners or by naturopathic physicians. There's not a physician, MD or DO, to be seen, at least on the website. So to me, that's a bit of a red flag, because, especially if you've got some underlying medical issues. So I could go on and on. I don't mean to rant about this kind of stuff, guys. Do your due diligence when you decide to go to a clinic. Trust your instinct. If you feel like something's not right, if they're not spending time with you, if they're not asking you lots of appropriate questions, if they're not answering your questions to your satisfaction, get a second opinion, go see somebody else. Again, these clinics are popping up everywhere, so it's not like you can't go somewhere else. But make sure that they're not just pushing testosterone on you, pushing nutritional supplements, make sure that they're talking about lifestyle, talking about nutrition, talking about exercise, talking about body composition changes. But really, the person you see should have your best interests at heart. And sometimes that means not prescribing you things like testosterone. Not every man needs testosterone, all right? You know you've got a good doctor if you see them and they say you don't need testosterone. You know, if you go to if a testosterone clinic tells you you don't need testosterone, you probably don't need testosterone, because most of them give testosterone to everybody. But you know, a doctor that says no to you when you ask them for something, that's actually a good sign, in my opinion. If they just have an open prescription pad and they're like, whatever, that's not good. That's not good. Okay, guys, that's all I have for you. Feel free to light me up in the comments, you nurse practitioners and naturopaths. I'm sorry. But I'd love to hear from you guys, and I will catch you next time. All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.